Good afternoon, everyone. My name's Laura Semple. I'm Assistant Director of Improvement Programmes at the Health Foundation. I'm chairing today's event to celebrate the launch of the Health Anchors Learning Network, and it's fantastic that you can all join us today. It really is a great pleasure to extend a very warm welcome to everyone here today. I really hope you enjoy the event and also that you really enjoy being part of this network over the next few years. Today really is only the beginning. So I'd like to share, first of all, a little bit about my motivation and interest in being involved in anchor institutions at the moment. And I wanted to say that personally, I really get a huge amount of energy from working in this space. And it's fantastic to be joined by so many people today who are equally energetic fellow travellers, if I can put it that way. So thank you so much for making the time today. I know how much pressure everyone's under at the moment, both in their personal and professional lives. So really do appreciate you giving the time to us. So I think the reason why I find it so energising working in anchors is that it's a reminder of the power we do all have as people working in health in its very broadest sense to create a positive impact for our fellow citizens. It's been a truly devastating year. We've all seen such enormous suffering all around us, and many of us, including me, have really wished we could do more to help. And at the same time, we might have felt much less in control of our work and professional lives. And now I think anchor institutions working in partnership across places really do remind us of the very considerable power that we do continue to hold to create change for the better. And of course, everyone here today knows only too well that with power comes great responsibility. And it's vital that we use this power purposefully and with a proper understanding of the local people we're working with and alongside. So that's just a brief introduction from my perspective. I'm just going to kick off today briefly with some housekeeping and some introductions before we move into the main part of the agenda. So I'm absolutely delighted to be joined by some really stellar speakers today. Dr Bola Owolabi from NHS England and Improvement, Dr Jennifer Dixon from the Health Foundation, and Cathie Cowan from NHS Forth Valley in Scotland. So we're going to have a conversation together initially and then go into a presentation about the network itself delivered by our colleagues at the Innovation Unit. There'll then be a bit of time for questions. We're really looking forward to hearing from you. And then finally, we'll close and talk about next steps and future opportunities. We can go on to the next slide, please. So just a bit of brief housekeeping for you. As I think you can see, we are recording this session and everyone who's signed up to the network newsletter will receive the recording after the event. So please do sign up if you haven't already and ask all your friends and colleagues to do the same. We will have a short break halfway through to give us a bit of a chance to have a quick stretch. And we're going to be using Slido as our way of receiving your questions, and there'll be a bit more info on that in a moment. If you'd like to use closed captions, you can turn those on by clicking CC. You can also turn them off in the way that's described here on the slide just by clicking CC and hide subtitles. And if you're having any trouble with that, please just do send a direct message to the host in the chat and we will help you with that. Okay, so I'm going to start by just setting the scene of what do we actually mean by an anchor. This is quite a complex area and I think it's important to start with some definitions. So to kick off, as a very simple explanation, anchor institutions are quite literally anchored in a place. They have significant resources which can benefit the local population beyond the original purpose of the organisation. Now, of course, for the NHS, this means leveraging resources and working with partners to positively influence the wider determinants of health which this year have been emphasised even more than ever. And in so doing, we can tackle health inequalities. All of that beyond the core purpose of the NHS, which of course is providing direct clinical care. Now, other sectors and some parts of the NHS have been working in this way for really quite a long time now. I'm thinking about local government and universities and many others, the voluntary sector, for example, and there's lots we can learn from there. Even within the NHS, we have some organisations and places that are more advanced in their anchor practice and some places that are at an earlier stage in the journey. And we want this network to be truly inclusive and to be valuable for everyone, whatever stage they're at. So moving on now to what actually makes the NHS specifically an anchor institution. Lots of you will be familiar with this infographic, which comes from the Health Foundation report that we published a couple of years ago. And it sets out what we see as the key areas in which the NHS can make a real difference as an anchor, all the way from purchasing and procurement to buildings, widening access to quality work, that's a really important one, and of course, reducing environmental impact. I really want to emphasise today that the cross-cutting role across all of these pillars of partnership working is absolutely critical. And for that reason, it's wonderful to see such a range of people from a range of organisations at the event today. So we also know that this work is happening at many different levels within the system. So we have hospitals, we have integrated care systems, we have primary care networks, and all sorts of other partnership groupings in the different nations of the UK, which all have a really key role to play in anchor work. And of course, there are some important related concepts, for example, community wealth building, social value and inclusive growth. There are nuances in the definitions of each, but the ethos is very similar. So now, having talked through the key pillars of anchors in the NHS, I'd like to give you a little background to the Health Anchors Learning Network itself. And I think thanks Gwen, I've got the next slide. So just a little background for you on the journey we've taken so far. So you see here on the slide, the Health Foundation's report, Building Healthier Communities, which we published a couple of years ago. And then we were really delighted to see in the NHS long-term plan a really strong commitment to anchor practice. And since the publication of these reports, we as a joint team from the Health Foundation and NHS England and Improvement have been working together to design a collaborative programme of work to really support colleagues across the UK to implement anchor practice in their local areas. We decided to develop this into a learning network because of the very strong evidence that exists from various countries about the ability of this method of change to really support colleagues to make progress on such a big and broad topic as we have here. And I think it's important to say that we've been very inspired by the work of the Democracy Collaborative in the US and also other colleagues in Canada. The US network is called the Healthcare Anchor Network, if you're interested to have a look at that. And as we move into the more recent past, since September last year, our joint team across the Foundation and NHS England and Improvement, having decided to partner with the Innovation Unit on this programme, we've been working very hard on an in-depth co-design phase for the network. So I want to give a big shout out and say thank you ever so much to all of you here today who've been involved in that co-design process. We've worked very hard together on it, and I'm sure that we will reap the value of that time spent over the next couple of years. So now just to go into a very high level overview of the objectives of the network. William will talk in more detail later about what's going to be happening, but in terms of overarching objectives, I want to emphasise that developing capacity and capability is absolutely key. We want the network to be truly action focused and very, very practical. This is not at all going to be a talking shop, and I'm sure you'll see that as the work develops. Secondly, it's going to be really important that we collate and synthesize learning to inform the evidence base. This is developing evidence base, and I think we have an important role to play in developing that, which in turn will help us to influence the policy direction as we move forward. And then finally, just to say that we're really excited about the UK-wide ambition of this network. There's a huge amount of great practice to be shared and learned from across all of the nations of the UK, and we're excited about everyone having access to that. So I hope that that's a helpful explanation of the journey we've been on so far. It's been quite a ride. And I think for now, that's probably enough from me. I'd now like to turn to everyone who's joining us today and start with our first question on Slido. So if I can ask you all to go to slido.com. I often find myself, it's easier to do this on a separate device, perhaps your phone, if you have one. If you go to slido.com and enter the code HALN, Health Anchors Learning Network, you'll see the first question pop up in a second, hopefully. And the question is, which of the 5 anchor themes that we talked about just now is your biggest priority? You can see these now on the screen. And of course, if there are other areas that you think are a bigger priority, we'd be delighted to hear about that too. So we'll just give a couple of moments to see those responses coming in. Great, so we can see lots of people talking about working closely with the local population and partners, big focus on employment, access to quality work, plus lots of other areas. Terrific. Okay, well, thank you so much for all sharing your priorities there, and that's been fantastic to hear from. We're now going to move into our conversation with our speakers today. And so, as I mentioned, we're absolutely delighted to be joined by Dr Bola Owolabi, who is Director of Health Inequalities at NHS England and NHS Improvement, and by Dr Jennifer Dixon, who's our Chief Executive here at the Health Foundation, and by Cathie Cowan, who is Chief Executive of NHS Forth Valley in Scotland. So thank you so much all for joining us today. Great that you're here with us. And so just to kick things off, I'd like to ask each of you, please, just to briefly introduce yourself and tell us why you're passionate about anchors. Perhaps we can start with Jennifer, then go to Bola, and then Cathie.
Thanks very much, Laura, and good afternoon, everybody. So I'm the Chief Executive of the Health Foundation, as you know. Why am I interested in anchors? Well, clearly there's lots of things we care about, particularly those of us in health. It's not just health, it's inequalities, isn't it? It's diversity, it's green, it's a whole range of other sort of things that we are important to our values, and it's why we work in the way we do and why we work in the health service and related. And I think, various things have boosted that kind of motivation, particularly in recent years, the pandemic being close at hand, but also I think austerity for the last 10 years has as well. The green agenda too, all of those I think are sort of boosting and increasing our recognition that lots of things we do are connected, and actually whatever our core job is, we can take a wider responsibility for benefit, wider public benefit. And I think that's true whether you work in the public sector, whether you work in government, or indeed whether you work in the private sector, or indeed even in the city. There's all talk about corporate responsibility. So the reason why, I'm clearly interested in health, and particularly concerned about the widening inequalities and the stalling of life expectancy, particularly in the last 10 years. And think that the NHS itself has such a position of not just economic leadership, because it's £140 billion in a £2 trillion economy, but also, without being grandiose, it has moral leadership as well. And it has technical leadership. It has a whole variety of things. And I think that more of these assets could be sweated, both at a national and a local level, to achieve public benefits. So I'm kind of interested to try to capitalise on this wave of interest and now to try to make progress on this agenda, but both at a local level through this network, but also at a national level as well. The national NHS role, I think, is important to consider, and you know, if we want to get onto that in this seminar. Thank you.
Thanks, Bola. Do you want to go next?
Thank you so much for the invitation to be here. I'm Bola, and I'm a GP, and I'm also director at NHS England, an improvement for health inequalities. I'm particularly passionate and excited about anchors because I think they really give us now a powerful lever to achieve what I think is the biggest legacy coming out of the pandemic, which is the narrowing of health inequalities. I think if there's anything that the pandemic has demonstrated to us, it's the fact that we had pre-existing health inequalities, which sadly have been further exacerbated by the pandemic itself. And to my mind, as we build forward from here, this really is the greatest legacy of our generation, is to narrow those health inequalities. And I think anchors give us such a powerful way in, you know, working in collaboration with other organizations, with our communities, with community action groups on the ground, to really start getting under the bonnet of those things that drive these inequalities. You know, we said within the NHS long-term plan that we can't treat our way out of health inequalities. That is true. It is also true that the NHS has a key and significant role to play as an employer, as an anchor institution in its own right, as an anchor institution collaborating with other system partners, as a commissioner and provider of services. And so I'm really excited about the potential and the opportunity that anchors give us to really harness all those roles of the NHS to move us into a fairer future. Thank you.
Thanks, Bola. Over to you, Cathie.
Thank you, Laura, and good afternoon, colleagues. I'm Cathie Cowan, and I started my NHS career as a nurse. And I suppose even back that length of time, I was very curious as a nurse about recovery times for people who had presented with heart attacks, with surgery, complications, and so on. And that recovery time was so much longer for those people who lived with poverty compared to those people who didn't live with poverty. So that has always been something in my value system that has made me curious, but also has mobilised my value system to make a difference to that overall agenda. Today, I'm the Chief Executive in NHS Forth Valley, and prior to that, I was the Chief Executive of NHS Orkney, one of the island boards way up there in Scotland. So why anchor for me? Anchor is a very ancient symbol of hope. And because of its functionality and that chain and rope, it holds ships in very turbulent times. It gives us stability and gives us that stability to actually work from. So anchor is that hope, and it's hope from this pandemic that I'm really keen to explore, exploit, so that we actually galvanise our resources with people, with communities, with partners to, as Jennifer and Bola says, to really narrow those inequalities. We've got a duty now to actually tackle this, and to tackle it with the passion and energy that it deserves. So I'm delighted to be here today, and thank you very much for the invitation.
Thank you so much. There's some terrific calls to action there, so thank you. So moving on to the second question, and this I think follows on nicely from what we've just been talking about. The NHS as an anchor and this Health Anchors Learning Network really are, you know, two pieces of a bigger jigsaw when we're talking about tackling health inequalities, the wider determinants of health and supporting population health. So I'd like to explore what is the potential role and impact of anchors within this broader context. And I'd like us to think both about the short term and the longer term NHS recovery from COVID. So perhaps I might turn to Jennifer first to kick us off on that, and we'll go from there.
So the way I start off with this, thank you, Laura, is to say that, you know, estimates vary as to how much of our health the NHS truly influences, and the estimates seem to vary, according to at least common wisdom, between 10 and 20%, which means that there is 80% of our health is influenced by wider determinants, social determinants, housing, where we live, crime, our education, our upbringing, our family, poverty, a whole range of other things that you all know about. The big players there are not really the NHS. The NHS has a role in influencing those things, but the big players aren't those things. The big players, if anything, is local government and central government and some other big local stakeholders, such as the local business community. Now, the government, as you know, has said that it wants to narrow the gap between, in terms of health inequalities in its prevention strategy. It's also said that it wants to extend healthy life expectancy +5 by 2035. It's also talking a lot about levelling up. If you look at the levelling up agenda at the moment, it's very narrowly cast. It seems all about infrastructure. There are a fragmented amount of pots of money local government has to go for, and yet the baseline of local government is actually not as high, let's say, has been cut dramatically over the last 10 years. So what I kind of want to say, the wider context to what we want to do here is not necessarily helpful to what we want to try to do, because when the NHS wants to partner with local government or with universities or with businesses, the environment is tougher than it has been for some time. So that's the kind of difficult context. And then the other challenge to mention is, of course, the NHS itself, which has a deep recovery programme to get underway and possibly facing threats in terms of budget in future because of the huge outlay to do with the pandemic, the 350 billion or however much, and so on. So those are the sort of clouds, I think, but important to clock. That's what the NHS has to work with. On the other hand, there is, as I was starting off with, an increasing mood that we've got to try to do something to address some of the key assets of our nation, whether it's the green natural assets, whether it's the human aspects of health, and so on, that you can't just go on by measuring success by GDP. So the good news is that there is some framework around the place at the moment that is nudging public policy towards this kind of agenda within which we all operate. So the Social Value Act is one, that you don't just make decisions on the basis of the thing in front of you, but also look at the impact on place. The Treasury's changed its Green Book to take account much more of local factors. There's a whole variety of things that are being put into position, which will help and reinforce some of the decisions made. So last thing to say is that I think the way I think about this is that there is a ton of things that can be done locally to try to further the agenda that we all set out at the beginning, whether that's staffing, estates, procurement, green, whatever it is, there's some little steps that can be taken that we should all try and see, and the network will help provide support to show the way. But there's also work that can be done with local government to try to make progress there too, on a wider set of issues to do with local regeneration and poverty and housing and all those other things. And there's still a wider agenda as well, which I think the national NHS can possibly take, to look to see how it as a national leader could leverage itself more and sweat its assets beyond the local to try to change the conversation nationally, whether it's with the Treasury in the Green Book, whether it's across government inequality strategy or whatever. There's a whole range of things. I won't bore on about them, but there's quite a long list of things that national NHS can do to create a more logical and systematic framework for tackling all of this, in which you will sit and act. So that's probably a longer answer than you wanted, Laura, but that's how I see it. It's a multi-pronged thing, but there's certainly practical stuff that can be done locally within the arms of the NHS, as well as with local partners, as we've seen. Thank you.
Thank you, Jennifer. That's great, and great to hear about the things that, you know, are will help us in this agenda, as well as the very significant challenges that we're having to face and work with as well. So thank you. Bola, I'd like to invite you to come in with your thoughts on this.
Thank you, Laura. I think that's a really important context that Jennifer has just been setting out there. And I would like to build on that still further by saying, actually, the potential, the opportunity that we have in the anchors is also set within the context of the NHS long-term plan and the commitments that it has made in tackling health inequalities, and specifically mentions, you know, anchors as a tangible example of how that ideal would be achieved. The same is echoed in the NHS People Plan that was published last year, and the Phase 3 letter in response to the pandemic, which set out the 8 urgent actions for tackling health inequalities. And of course, we've seen the recent publication on tackling poverty and highlighting the key roles of anchors within that. And actually, I'm thinking about the planning guidance, the NHS planning guidance published in the last hour. Again, prioritizing health inequalities, the role of population health approaches in doing that. And so within all of that context, I can see, just building on my earlier comments about the 4 roles of the NHS, you know, that role as an employer, the role as an anchor institution in its own right, its role as an anchor institution in partnership within integrated care systems. And that's a really important point, because of course we know the NHS is the biggest employer in many communities. It's the biggest owner of estate. You know, it has such a presence in so many communities that I think, you know, just reflecting on Jennifer's comments about its leadership role, I think there is a real opportunity here, you know, for us to be more thoughtful about how we choose to deploy our resources in order to influence and to work in partnership with others, you know, whether that is in terms of our social impact, our economic impact, our environmental impact, etc. So I think these are all the areas that we can really make a significant contribution as an anchor, but as a bigger anchor in place is what I would say. If you consider that 1 in 15 of all the jobs we have are in healthcare, and in some communities like the Northeast, that rises up to 1 in 10. So that again really gives us a powerful insight into the opportunity here for the NHS to work in collaboration with people, organizations, and systems to begin to be thoughtful about how we deploy our services going forward as an anchor institution. Thank you.
Thanks so much, Bola. And I think I might come straight back to you first, actually, Bola, on the next question I'd like to ask, which is really about the potential of this network specifically to support the uptake of anchor approaches. So can you share with us, following on from that last point you made, what is your biggest hope for this network?
My biggest hope is that this network becomes a coral reef where people can come together, generate ideas, nurture those ideas, and translate them into tangible intervention. And I think we will know that we are succeeding when we get to a place where the network is able to create what I would describe as virtuous circles, whereby we have data that gives us actionable insights. Those insights translate into tangible interventions. Those interventions do have a demonstrable impact. And from that, we generate intelligence about what works. And that really is my hope for these networks. I think there's also something about them being an opportunity for us to genuinely commit to collaboration. So the government white paper on integrated care systems talks about our duty to collaborate. I think the network gives us a tangible translation of that ambition into practice, if you like. I think there's also the opportunity of partnership, as I've been saying. And then, of course, providing that system leadership that begins to create a narrative that changes the culture from one that can tend to describe and analyze almost to a point of paralysis, but shift the culture to one of using insight to generate intervention, because that is what matters. You know, the people and the communities that we're talking about will be justified in frustration to see action on the ground. And I really do see the networks being that engine room where we can really accelerate on the intervention front, but all the while collaborating, all the while partnering, all the while generating these virtuous data cycles and presenting the leadership and thought leadership that this agenda really needs to move forward.
Thank you so much, Bola. I mean, really great to hear about the vision for virtuous circles there. I think that's so important. I'd like to ask you, Jennifer, to share with us your thoughts on, you know, what are your greatest hopes for this network? And as you mentioned in your previous answer, the network has a critical role to play. There are other things which are important for driving anchor practice and creating a conducive environment for this work. It'd be great if you could talk to us about both of those.
Yeah, thank you. I mean, I largely agree with Bola, absolutely all of that. I mean, clearly the network will play a really good practical role to build moral support and share information, share good practice and show tangibly what works. And I think that's going to be, you know, if it does just that, then it's succeeded, as well as obviously trying to show some tangible outcomes. But I think beyond that, a couple of other things. One is that, as Bola said, that from this network can rise leaders for whom this is core business territory, and they feel confident. And they feel confident not just in the NHS's role, but also in dealing with partners locally to help regenerate areas more fully, particularly those who are sitting in areas. Well, there are various sorts of areas, aren't there? One is the sort of cities where a lot more connections between universities, businesses, other assets are there to be taken and can be. Another would be leaders in small towns where the NHS is positioned that may have other sets of assets to draw upon, maybe the voluntary sector more, I don't know. And then those leaders who are really in what's called left behind areas, rural or left behind coastal, where there may be a whole set of other assets. So anyway, leaders in different sorts of area. And then ultimately beyond that, so to change so that there's a critical mass, so that the conversation can be changed at a more with a wider set of local partners, but also at national level as well, that this is the way of doing business, that social value beyond core business is important if we ultimately want to improve health. That has to be set alongside and a clear-eyed view and a skeptical view of the limitations that we all work under. You know, the fact that we are constrained resources, we need to ensure value for money. You know, you've got to stick to the knitting, and you are performance managed, etc., etc. But I'm hoping that with good leadership, it's not a either or, it's a both and that confidence to articulate that case over time and show the link will come through over time. Thank you.
Thanks so much. I think some really useful and important points there. So I'm actually going to turn now to a question that's come in from someone who's joined the event today. And it's really about working with local governments. We've already talked about local government a couple of times so far, but the question is, how will the network work with local groups, local councils and councillors? So I wonder if, Bola, would you like to maybe link this question to, you already made reference to the white paper and the duty to collaborate. Perhaps could you share some thoughts on that point?
Yes, thank you. I think the great thing about the networks is that they're not NHS exclusive networks. And that's where I'll start. And that's what I was saying earlier on about, you know, the potential for them to be this coral reef, where all of those organizations, local authority, voluntary sector partners can come together as equal partners. You know, with this common purpose of starting to make inroads into the health and well-being of the populations and the people that we look after. And so for me, it's not so much how the networks will work with these organizations and groups. I think it's about how those organizations and groups will come forward to be part of the network, because that really is the way that we're going to make sure that it isn't simply a health-centric conversation, you know, in the way that Jennifer was saying earlier on, which is true. Public Health England have left us in no doubt that actually the contribution that healthcare makes to people's health and well-being is probably in the order of 20%. The rest of it is down to those wider determinants of health. And therefore, we need those partners along with us in the networks so that we have that holistic conversation that is not just grounded in the kind of biomedical school of thought and, you know, health interventions, but a more biopsychosocial conversation that recognizes that people are not an assembly of diseases and conditions, but actually whole human beings who may happen to be living with these difficulties within communities that may equally be challenged. And so it's that sort of holistic yet tiered approach. And the way to do it is to be in the network rather than outside partners, if you like. So that's me putting in a plug to our local authority colleagues and our VCSE colleagues to strongly consider joining the networks, and let's do this work together.
Thanks so much, Bola. Jennifer, is there anything you'd like to add to that before we turn to Cathie?
Thanks. I mean, I think obviously the NHS has relationships with local government already. Public health is quite a good gateway, isn't it? The consultants in public health and the public health teams that work in local government are often a gateway to the rest of what local government, the assets that they have. Local government have access to a whole range of other partners, so they can be the they can help with that hinterland for the NHS where that makes sense. If they have access to pots of money, I mentioned earlier all this towns fund, levelling up funds, even if they are infrastructure, they are investment that's going. So local government has that. They have the local economic partnerships to work with. They also have a huge amount of data which can help understand the impact of social value work that the NHS is performing, and data linkage and so on. And they also share a lot of the same values of public service. So I think all of those assets are absolutely worth pulling on. This is all about relationships when it comes down to it. It's about people, and it's about all of the leaders there, having certain behaviours, which means that everyone can contribute, and that there is clarity of strategic purpose. So I think, just a plug for those of you who haven't seen it, there is something my organisation produced called Anchors in a Storm, which is about lessons from anchor action during COVID-19. One of them was to make sure that there was a sort of strategic focus and a leader who can help to make sure that could be quite a disparate mass of stuff is actually coheres into some planned programme. So that's what thank you.
Thanks so much, Jennifer, and that leads on very well into our next session, where we're going to hear from Cathie about her work in Scotland. And I think following the introductory session that we've just had, it's going to be really useful to hear in a bit more detail about what it really takes to make this happen on the ground. And very grateful to Cathie today for sharing her experiences. I might just ask Gweno if you could share the link for the piece Anchors in a Storm, which Jennifer just mentioned. That's a link to a piece on the Health Foundation's website if colleagues would like to take a look at that. So without further ado, I'll hand over to you, Cathie, and Gweno's very kindly going to share the slides as we go through your presentation. Thank you.
So thank you very much, Laura. What an interesting conversation, and I was just struck as not only a person that works in the NHS, but a person who has worked in local government, and the power that we can harness from working from each other. Although your kind of visionary piece around coral reefs will stick with me. What a picture in my head, so thank you for that. So colleagues, good afternoon from NHS Forth Valley. It's a cold, wet and windy day in Scotland, and only yesterday it was really hot and really lovely. And of course I'm joking, the weather is something that we don't enjoy. So I'm delighted to be a participant in this conversation. The numbers participating today speak for themselves. I actually hoped, like Jennifer and Bola, that today is the start of something new and something very bold. So from what I've heard thus far is that we share a mutual ambition, built from a concern that cannot be solved by one person or by one institution. An anchor approach calls for collaboration. It reaches out and connects a variety of people across new boundaries, and with that comes real new possibilities. On a personal level, I believe the timing to reset and to rebuild a new economy puts well-being at the heart of what we do. This, I would suggest, is within our grasp. This, I would suggest, is for us to now reach out and create a movement at pace and at scale to advance economic, social and environmental justice. We the people in this virtual space excuse me, have the resources and the levers to think how we work with local people and local communities to build better, fairer and greener, viable and vibrant local economies where people can flourish and prosper. COVID, we've heard, has shone a light on imbalance, It shone a light on inequity and the gap between those who have and those who have not. Colleagues, I suggest that gap has become a great big gaping hole that we can no longer justify or indeed ignore. If I can move to my second slide, please. In Scotland, community wealth building supports our wider policy ambitions. Ambitions to be a world-leading wellbeing economy where economic growth is inclusive and benefits everyone. And as an ambitious country, we want to be known for walking that talk. Inclusive growth for us needs to be just that. It needs to be inclusive, not selective, not unfair, and not discriminatory. We're a country that believes in opportunities for everyone. And we want to create a society which treats everyone with kindness, with dignity, with compassion, and with respect. Poverty is not just bad for growth. Poverty is bad for well-being. It sucks the very lifeblood and ambition from the people and communities that have so much untapped potential. So a key role for anchor institutions is to work with people, to work with communities, to build confidence, to build resilience in those in greatest need, and to see and grab the opportunities that life can offer and to co-produce these opportunities together. So at a macro level, we talk about community well-being and delivering a well-being economy in Scotland for Scotland. And we put that commitment into practice when we, along with New Zealand and Iceland, launched the Wellbeing Economy Governments Alliance in 2018. I would suggest, colleagues, that well-being is not for the faint-hearted. It has a hard edge. It demands of us to think and to act differently. It requires of us to get involved, to really understand the issues, and to engage with people, and to cultivate engagement between health and care and economic development in ways that I would suggest liberate the 5 principles of community well-being. That inclusive ownership, that spending leverage that maximise community benefits, that creates a workforce that supports the well-being of communities we serve, the land and property and how people have access to that and use it, and the finances that works for local people, local communities, and indeed local businesses. So along with our wellbeing commitment is our national performance framework. That puts growing up, being loved and feeling safe and respected alongside global competitiveness and quality jobs and fair work for all. I introduced the national performance framework at this point in time to remind us in this room of the power of paying attention. Colleagues, what we measure matters. What we pay attention to matters. I believe that anchor organisations and what they can deliver matter. Slide 3, please. So, to give you some context about where I work. If we could move to slide 3, please. So, in that context, I hope to share some local examples to give you a flavour of what we're doing here in Forth Valley. And indeed, colleagues, if I had time, I would showcase the wonderful things that you're doing and the wonderful things that people are doing in Scotland. Scotland has 14 regional health boards and 7 special health boards. I work, as I said earlier, as the Chief Executive in NHS Forth Valley. It's a board that serves a population of just under 300,000 people. It's got an annual budget of about 570 million and it employs around 8,000 staff. Our acute hospital is supported by a network of community hospitals and has something like 56 health centres. As a health board, we play a key role in the delivery of the Scottish Government's programme for government. Community wellbeing forms a central theme of this programme, and our national performance framework has a mission to create new jobs, good jobs, green jobs. Community wellbeing supports our wider policy ambitions that brings together a wellbeing economy and inclusive growth. Next slide, please. So at a local level here in NHS Forth Valley, we are absolutely passionate, enthusiastic, committed to using our anchor advantage. Our story is not unique, not dissimilar to many, but it goes beyond public health, and it invites all the directorates in a health board. It invites all the departments and local authority. It invites the third sector, the local businesses, to come together to embrace the 5 principal pillars of community wellbeing. And it invites us to think differently together about how we can achieve them in ways that maximise the benefits offered to our local communities. Colleague, COVID has created a burning platform, but it's a platform that invites action and offers opportunities for people, for communities and organisations to come together, to act together and to innovate together. In Scotland, and forgive me, I don't know what the comparison would be in the rest of the UK, but in Scotland and in the Forth Valley, we have got what we call community planning partners. And our community planning partners will be coming together at this point in time to negotiate what we call our local outcome improvement plans, coming together to review our economic development plans, coming together to agree our health and social care innovation priorities, and to implement our city and growth deals. So timing for us is critical. So a burning platform, timing critical. That moves me to leadership. So what is leadership? What is the leadership we bring to these local, or from our local anchor organisations? We bring a leadership that is hugely important within these developments, to nurture that whole system thinking and community wealth building within our own organisations and beyond. We believe in Forth Valley that that needs to be embedded in all our planning and indeed in all our actions. We want to build in our community planning processes, and in that we want to introduce what we're referring to as our consortium approach. We want to work alongside and with our communities. People need to be part of this. They need to coexist, and I'm thoughtful of that coral reef that was introduced earlier. So for me, anchored institutions deliver community wealth building at scale and at pace. Forth Valley has got partnership foundations built up over years of community planning, and this certainly will enable us to progress that, as I say, at scale, utilising our knowledge and the resources, not just of us as an anchor organisation, but the anchor organisations that surround us, the colleges, the universities, the local government, the third sector, and so on. So we talk about thinking regionally and acting locally to minimise that silo thinking. Not allowed. We want to embed population health outcomes in agreed regional economic strategies. Jennifer referred to the contribution that health makes to people's well-being, and it's kind of that size. The wider determinants of health are actually things that we need to go out and connect to: jobs, houses, transport, and all these good things that make a huge difference to the people that we live with and support. We want to use our specialist partners to plan using innovative data sources to test how local economic factors and the changes that we're introducing can influence and are influencing health and health inequalities. And I'm like a good partner. We want to capture that learning, the good and the not so good, to influence adoption and spread across the region at scale and pace. So colleagues, we believe that anchors are a symbol of hope. They bring together people, they bring together partners who are struggling with a mutual concern. I believe the network that's been spoken about today really signals a period of new beginnings. And I think by working together, we have so much potential, especially when we work with our communities, to address what I would call that big, gaping inequalities hole that, for me, can no longer be ignored. Colleagues, thank you so much, and it's been a privilege being part of this conversation.
Cathie, thank you so much. That was really wonderful to hear in some more depth about the work you're involved with and leading in Forth Valley and across the region. So thank you so much. That was terrific. And I'm sure lots in there that colleagues will want to take away and discover more about and look at how they can adapt to their local context. So in terms of the next sessions on today's event leading up to 5 o'clock, we're actually going to take a really short break in a moment. Just before we do that, I'd like you to return to Slido if you can, please, and let us know what do you think is needed to really drive anchor action across the health and care system. You've heard from our expert speakers already on their thoughts on the matter, but we're really keen to hear from all of you, bringing your local expertise. So please do contribute your thoughts there on the Slido, and we'll take a quick look at what's coming out as the major themes there. I like someone's put humility there. I completely agree. The need to learn from each other and not reinvent wheels. That's what the network's all about. So great to see that. Bravery, listening, yeah. Connecting, well, whoever wrote that's definitely in the right place. Vision and system leadership. And also, I think some really important points coming through there about the really thorny challenges that are really important to acknowledge. And we really believe that in the network we will be strength in numbers in highlighting those challenges and working together to get some action on them. So really great to see that coming through. Okay, thank you so much for your thoughts on those. We'll make sure to read them all in detail afterwards. For now, I'm going to ask everyone, please do take a very short break. I'm going to say 2 minutes only, please. So by my clock, that means to be back by 4:29. So have a quick stretch. I hope there's some sunshine and blue sky out of your window to look at, as there is here in North London. So we'll see you at 4:29. Thank you very much, everyone. Hello everyone, welcome back. I hope you all managed to have a quick stretch there, and back with us now till 5, and we've got some great content still to come. So for our next section, it's my great pleasure to introduce William Roberts from the Innovation Unit. Innovation Unit is the organisation we're partnering with to deliver the network. And William's going to talk in a little more detail just now about exactly what it's going to feel like to be part of the network, and talk about some of the really exciting opportunities coming up for you all to get involved in. So without further ado, I'll hand over to you now, William.
Thank you, Laura. Lovely to hear everybody so far. It's some really exciting stuff, and thank you to everybody who's been contributing in Slido and in the chat to give us a whole load of stuff that we can take away and look at. Just one thing, somebody had raised about the closed captions. This is an AI closed caption on this, but in the video later we will be using full closed captions. So yes, there will be better translation of that for you in the next version. So if we just quickly talk about the network a little bit. So we've already heard from Laura about the network and what it's trying to do. It's a UK-wide network. It's going to be a place to learn and share, and an opportunity really to connect with others. And we want to see it very much as a place where people can come to talk and share and learn in a collaborative way. And it's very much based around an idea of peers coming together and learning from each other. What we'd like to think gives people a real opportunity to think about how to adapt and adopt work from elsewhere, because we know that there isn't a one size that fits all, and you can't just lift and shift things from one particular place to another and just expect them to work. So we want to give people the opportunity to do some of that work. We've heard today from the speakers about some of the themes and some of the topics we might be doing, but again, when you look at some of the questions that have come up in Slido, there's a huge diversity of opportunity, but also views in this. So early on, we'd like to hear from people about the work they've done. So if we just move on to the next slide, Gweno. Thank you. So a couple of ways in which you can really get involved in the network. Firstly, hopefully you've already signed up to our newsletter. If you haven't, please can you do so, so that we can share with you what we're doing and share our work with you. There's also a workspace on Future NHS where we're going to be able for people to come in and to chat and to have conversations, and to be able to also put on their own work and to share. We've got some really exciting events coming up in April onwards. So if you're wanting to go over to our website, the link to which is on the screen there, and we can also put into the chat, please do go over there and have a look at the events we're running, and do sign up to them. And we'd like people to really sort of engage with that in a way that allows us to understand what are the biggest needs out there in the system, but also what are the things that we can do to help you make the biggest difference early on. And then finally, we'd also like to hear the things you're doing. So one of the things that's really clear from the co-design work we did before launching the network was that there are brilliant examples of this work all over the country. So in all 4 nations, people are doing amazing work, not just within the healthcare sphere, as we heard, but other sectors who are doing really brilliant work, be that in housing, local government, universities, and also in voluntary sector providers as well. And so we'd love to hear from that. And if you go to our website again, we have a form on there which you can submit some information about what you've been doing, and give us an idea of the kind of work you're doing, and not just the what you've been doing, but also how you've been doing it. So we're kind of running out of time, so I'd like us to sort of move on to the next bit of this. Before I hand back though to Laura, just to take a few more questions and to close the session, we've got one more ask of you on Slido. So if you go over to Slido, we'd like to hear from you about what examples of your work you or your organisation have undertaken. So have you done work in this space already? Is there something you'd really like to share with us? And if you're happy to, please do put your name in there, because if you signed up to our newsletter, we'll be able to then get in touch with you to talk a bit more about that, or also think about our future sessions in relation to that. So if you could just take a moment or two to put into Slido any examples you've done around anchor work, either yourselves or your organisations already. And then once we've done that, I'll hand back over to you, Laura. Thank you.
Thanks, William, and great to see some thoughts starting to come in there on the Slido. quite a lot in here about employment, which is really interesting.
Yeah, it's a huge diversity of things that are going on. I think it's one of the things that I sort of reflect from some of the early work we've done as well. There's just so much in this space that you could do. And so I think really thinking with the network about sort of the biggest things that can make the biggest difference in the first instance, but also what to do later on would be really interesting.
Absolutely, and I know some colleagues have been asking about, you know, how can people find help to know where to start? I think that's you know, so important and not easy when there is such a variety of things one could do. So as you say, William, helping people to know where they can get best impact at the beginning is going to be a really key focus of the network, isn't it?
Absolutely. There was a great question in Slido where somebody said, you know, effectively we did all the stuff we needed to do about writing the plan, but actually how you do it, that's the hard bit. And I think that's one of the real challenges of a network like this, is not just what do you need to do, but how do you go about doing it, both getting started and then making it really work at scale. And there were some great examples in Slido, I think, about, you know, people bringing in examples of how they've used apprenticeship schemes or return to work schemes really brilliantly. People thinking about, there was a real challenge in one of the questions about, you know, how do we get the NHS to think about living wage employment as an example? And so I think there's some really big challenges in there for the network to start to think through. And I think for yourself at Health Foundation and also at NHS England and Improvement to think through about, what do you want to do about that, and how are you going to make sure that the policy is also helping with that, because I know that's come up in the slides as well. So I think we're getting towards the end of people being able to put in, but if we give them another minute or so, because I see that we're getting a sudden flurry because of the typing lag.
Yeah, no, absolutely. I can see some really terrific creative initiatives coming in here, and some really interesting and new partnerships that I certainly haven't come across before. So thanks so much everyone for contributing those. These are a really great foundation. Okay, well, thanks everyone. I think we're going to move on to the final section of our session this afternoon. Thank you so much for contributing your ideas there. Our final session is a Q&A session. So if I can invite Cathie, Bola and Jennifer to switch your cameras back on. We have some very good questions for you here, some of which have been submitted in advance and some of which we've received during the course of today's event. So I'd actually like to just pick up off the back of those really terrific creative ideas we just saw coming in on the Slido there. I know from my own past experience, it takes really excellent leadership to get these creative and innovative plans actually off the ground and actually happening in practice. And this links quite nicely with the theme of leadership that's come up quite a bit this afternoon. And Jennifer, I really liked what you said, where you said from this network can rise leaders for whom this work really is their core business, who can then in turn support the next generation of leaders coming through to act in a powerful way in this space. So I think for the first question, I'd actually like to turn to you, Cathie, and, you know, drawing on your experience and your work in Scotland. The question is, are you aware of any specific work that's been undertaken to really surface what the necessary conditions and or leadership capabilities might be to establish true collaborative working with local communities? As you rightly said, this is not easy, so I'd be really keen to hear your thoughts on that question.
So I think I'll use an example of my time in NHS Orkney. And it's a NHS example, and it's about mobilising communities in a way that actually enabled us to access funding for a new hospital, which was hugely significant in Orkney. People had spoken about it for years. So what were the conditions? Well, we had a common purpose as a community. This wasn't about just the NHS, this was about people, it was about communities, and it was about partners. So we secured funding. So we had a big capital project in Orkney. So what did we do with that? We actually made sure that that capital project and the people who were coming forward to actually build the hospital had significant community benefits tied into it. Apprenticeships, linking up with local hotels, linking up with 25 years contribution to an ongoing apprenticeship programme, management trainees and so on. So that example kind of, so we had shared purpose, we had strong collaborative leadership. This mattered to people, to communities, to leaders. And in actual fact, it mattered to the community going forward. So for me, it's about big or small examples. In Glasgow, the neighbourhood example would be really giving power to communities and to people, because they actually make the difference. Sometimes we think that we make the difference. Sometimes it's our empowering leadership that actually allows people to come together and be supported to deliver. So the conditions for me in terms of this space, COVID has gave us the burning platform. We have got mutual concern, mutual ambition. We've actually got resources that are hugely significant, and we know the things that we need to do to tackle inequalities. Our people told us what we need to do, so we need to get on and do it. And I saw a lot of that in the chat. This is not about talking, this is about doing. And by doing, we galvanise people to move forward in a way that actually begins to create this movement that I refer to.
Thank you, Cathie. The next question that's come in is related, I think, but building on this question of what's needed in terms of leadership capability and practice. So the question is to create an environment across our local community which enables change and innovation to emerge without critically trying to control it. This will require a different mindset that anchors need to approach each other as an equal partner, with no one being a dominant organisation or voice. So I wonder, Jennifer, I might invite you to come in on that, perhaps building on the thoughts that you shared earlier around the role of the network in developing leaders.
Thank you, Laura. Just a couple of comments on that. I mean, I really like what Cathie had to say. I mean, clearly this is about doing and getting some quick wins. But at some point, a lot of energy and time can be soaked up with doing a lot of disparate things. So the leader also, in addition to being permissive and encouraging, also has to be able to stand back and see the wood for the trees strategically, to know where there may be gaps or where more buttons can be pressed, and think about wider opportunities. So it's an interesting challenge, and that's generic to all leaders, by the way, isn't it? So I think that's my main contribution to this particular question. Just remind me precisely what you asked me, and I'll try and answer it more specifically.
That's fine. Well, I think you have answered.
Is that enough? Okay, that's good.
It was just around the mindset shift that will be needed for leaders.
Yeah, sorry, there was one other thing. I mean, the mindset shift is the other challenge for any leader is to be absolutely clear-eyed, of course, about the constraints in which they are working, and the tension and the trade-off between the objectives. I mean, NHS has got a big recovery plan. It's got to stick to the knitting. It's got to get, tackle this huge amount of suffering in its own backyard, which is represented by people, pent-up demand for care and people waiting. It's also got to tick the value for money box and make sure that that the targets are met. Otherwise, the thumb screws come down. But a good leader will recognise all of that, but still be able to create some space to show leadership in this wider social value. And not only that, but to argue for more space and for less constraints. So it's easy for me to say this, isn't it? I don't work in the NHS. I'm looking at Cathie, who does and knows exactly what this means. But when times are tough, those pressures are high, and that has to be acknowledged. Otherwise, it seems like nirvana. And then people get demotivated because they can't achieve nirvana. So I think it's a clear-eyed job that the leader has to have, and hold all of that in tension, but still make progress. Thank you.
Thank you, Jennifer. That's very helpful, and it links with some other conversations we've been having recently in this work, where we've been listening to colleagues, you know, guarding against the risk of falling into what you might call magical thinking with this work. So, you know, it's easy to fall into the trap of thinking, you know, we try a new employment scheme or something else equivalent locally, and then automatically we'll have a dramatic effect on the local determinants of health. You know, we know that's not the case. This needs to be a multi-pronged approach, you know, across all partners, and indeed working with national policy levers as well. So, you know, continuing to recognise that complexity, whilst, as you rightly say, Jennifer, we need to not get demotivated. You know, we need to recognise the unique contributions that we do all can each play in our day-to-day work. So, building on that, there's a question around social value, and this really links to the previous question with someone rightly saying about the need for people to be collaborative and not to behave as a dominant voice or a dominant partner, perhaps due to organisational size or other reasons. And so this question is about social value, and saying that social value is really quite newly emerging as a priority in the NHS, but it does have a long history within the community and voluntary sector and with local authority colleagues. The question being, how do we ensure that social value in this context that we're in does not become a tick box exercise, and that it's meaningful, and what's the role of this learning network in helping with that? I might ask you, Bola, to come in first of all on that one.
Thank you. The subtext to that question is so important. Because it talks about how do you prevent one partner from becoming a dominant voice or indeed force in that common endeavor. And I think for me, the social value question forces the conversation around parity of esteem. You know, if we're going to deliver social value, then every voice around the table does need to be prized equally. And I saw a comment in the chat box that said, but how do you lead when everybody has equal authority? I think the way we do that is to have a clear vision of what it is that we're trying to achieve. We have a common purpose around which we agree to coalesce. And reflecting on Jennifer's comments there around, you know, the being clear-eyed about your constraints. I think being clear about the scale of ambition versus what you can action is really important, you know, in this space of adding, you know, social value. So I think that's really important. And there's something about the levers of influence. And knowing what your levers of influence are. So yes, a significant element of it is funding, but actually sometimes you can call upon other levers. So we had a fantastic presentation yesterday from JWIC, from Ed Garrett, who is the chief executive there of their ICS, a very compelling account of how they collectively, the NHS, with the local authority, with the community themselves, chose to change the narrative about their community. You know, people during the Trump campaign, they were named, you know, as the place where you don't want to be. And actually, I think in their case, starting to add that social value was to collectively change the narrative about the place to the people themselves, which then started to have currency outside. And that then attracted, you know, GPs who were prepared to come and work in that community where they couldn't attract people before. You know, there is a conversation now emerging with industry about offering people employment opportunities in a place that those conversations just didn't happen before. And I didn't hear about any voice being predominant above the other. What I heard was people having a clear vision of where they wanted to get to, having a common narrative about it, having a shared purpose about how they were going to get there, and recognizing the balance between the scale of their ambition and what they could actually achieve, and looking for other levers to influence their vision happening. And I really commend that way of thinking, to people on the call, to myself, as we think about, so how do we bring about the social value question? Let's not define it through the lenses of one organization. Let's have a common narrative about what we mean, and then bring our collective endeavor to achieve that. That would be one of the things I would say. And I commend Jaywick and Ed Garrett and his team there, to people on the call. It's a fantastic story there.
Thank you so much, Bola. It sounds like there's going to be some really useful work for us to learn more about and explore there. Jennifer, did you want to come in there?
Yeah, I mean, there is a Social Value Act that's been in place since 2012, and it's not really, we don't really pay as much attention to it as we would like. So a lot of CCGs don't take it into consideration in procurement decisions, for example. The mandate out today will not include anything about that. There could be more signalling, when reconfiguration decisions are being made, for example, some sort of examples of where there could be some articulation of why social value is important, as well as the cost-benefit analysis of, and that's what I was trying to say earlier about the Treasury. Even the Treasury, with its Green Book, has finally sort of tweaked it so that cost-benefit ratios aren't the only game in town. Social value is. So to have one or two national examples of that would be quite good, and just to set the tone that this is something to be considered, even if you don't quite have to tick the box yet. Do you see what I mean? So I think we've got some mechanisms, but we're not really taking much notice of them already. Thank you.
Thanks, Jennifer. Really important point. And that leads quite nicely to, I think, what's going to be the last question we have time for today. But it's a question that's come in during the course of the session, and it's about procurement and spend. So how can we overcome the issues of centralised procurement and funding to drive local change and to really leverage the anchor potential of NHS trusts? So this is a very big question. It's a complex arena. I might invite you, Jennifer, to contribute first of all on this, linking to the comments you just made about the overall policy context.
I was looking rather hopefully at Cathie, who might have something more specific to say. But just to say, this is a great question, because obviously this is where it gets back to the national sort of weather that's created, because of course there is something called the national procurement rules, which is moving the NHS, particularly non-clinical service, over to 80% centralised procurement. And it's doing that for really good reasons, in one sense, because it wants to ensure quality and value for money. That's narrowly cast, not really considering wider social benefit and local. So this is partly the constraints that, and similarly reconfigurations decisions are made with that in mind too. It's about quality of services, and it's not about, whether Blackpool could do with it. Should not suffer the pain of withdrawal of local employment from a closure of an NHS institution, for example, just as an example. So I don't know what the answer is, but I do think the answer is, one approach is to, at a national level, just to look at all the messages being given out. On the one hand, Social Value Act, on the other hand, central procurement, and to try to weave this together into something that makes sense nationally, and then be confident to then speak about it. And to act and to make some decisions on that basis. But I think at the moment what we've got is a fragmented set of things, a bit like, the analogy will be the government with its levelling up agenda. It's got all these towns funds, rural communities, all with different criteria, unified by a vague levelling up label. in the NHS unified by a social value label, but there isn't a kind of coherent approach that would give people confidence to make those decisions and trade-offs. So that's a rather abstract discussion, but I'm looking rather hopefully at Cathie, as I say, to add some practicality to that.
So for me, in terms of procurement, we've kind of went from one extreme to the other. And like Jennifer, I get the bit about quality, I get the bit about value for money, I get the bit about negotiating contracts when you've got big contracts and you can really push down price and the like. So, but I personally think we've swung that pendulum too far. I actually think that we have actually cut dry local businesses who really relied on our work and were part of our communities. So I think there has to be some kind of balancing act about NHS goals, certainly in Scotland, and we're really looking at that, about the powers of procurement that we can contribute to our local communities. But of course, we can procure third sector, so that social enterprise model. We can procure colleges, universities. So there's lots of things within our gift set, but I really firmly believe that pendulum has swung too far. I get the bit about, the benefits, but I actually think there's smart people around to actually do that benefit analysis work to say, in actual fact, what are we getting back for that? Because in actual fact, local jobs are lost, local businesses could be lost. So there's something about, if we're really serious about putting the power into local communities and actually getting local people to stand up and be counted, and they will, then we have to change the rules around this. And as I say, we're looking at that in Scotland, but there's something about the network, I think, where we need to share those examples and we need to influence. The network isn't just about sharing examples, it's about what does this network do, what does this voice do to influence policy shift, practice shift in ways that benefit us. Because that's what anchors for me. Anchors about hope, it's about change, it's about doing things differently. And if it's just going to be that kind of same old and a wee bit of shift here and there, that first order change stuff where we put sticking plasters and things, that's not for me. And that tells you something about my leadership, I suppose. This has to be bold and brave, and it has to be something different. People will take responsibility if we give them that. They will do wonderful things. I've seen it when I worked in Glasgow, in Govan Hill, in the networks, in the neighbourhoods, where people actually make a pound go much, much further than we could ever imagine. So the procurement rules, I think we need to, maybe a first task, really influence that change.
Thank you so much. We've just got a couple of minutes left, so I need to say a couple of closing things before we go. But just before I do, Bola, did you want to come in briefly on that? I couldn't quite tell.
Yes, if that's okay. I was just going to say there's something about strategic alignment. And now that the NHS has put itself so firmly behind the tackling health inequalities agenda, I find that places like Lancaster and South Cumbria, I've just put some examples in the chat box, are doing some great work on procurement for social value, but they're doing it through that lens of narrowing health inequalities. And I think that's a really important strategic alignment to note and to use to transact that conversation as we go forward. And also been talking even to the national procurement team. And again, there is just that appetite. My team is getting a lot of inquiries from procurement teams, which I think is fantastic, because people are saying, look, we just want to make sure that going forward, we're doing this in a way that is narrowing health inequalities. So it may be that the social value terminology may not have gained the same currency, but you can see that that's where people are trying to get to. So I think there's something about just leveraging that strategic alignment, but recognizing that there is great appetite now, particularly from procurement teams, which I think is fantastic, to make a contribution towards narrowing health inequalities. And we probably need to just steer a little bit further to say, and the way to do that is to behave as an anchor institution and be mindful of your social value responsibilities. It just makes it a natural sequence in the conversation for people. But I just wanted to make those connections.
Thank you so much, Bola, and there's a lot of great wisdom there, and a lot of this work is about just that, isn't it? Is breaking down some of the traditional silos between groups of people within the NHS. So fantastic to hear that increasingly procurement experts, for example, are getting in touch with your team, Bola. I think that's really encouraging, and we've had quite a lot of interesting conversations already around places that are working successfully with local suppliers and making sure those suppliers are providing good quality work, that they're operating in a way that's as green and environmentally sustainable as possible, so on and so forth. So some really creative approaches to that that we're seeing already, and great to see them grow. So I've tremendously enjoyed our conversation this afternoon. I'm very sorry to say we are pretty much at time, and so we need to conclude for today. So just a few final remarks from me. I think from the material that we've covered, I'm certainly even more excited than I already was about the prospects for the network. I think we can all take a lot of energy and motivation from the point that Cathie made around, you know, anchors really do hold the ship steady in the turbulent times that we're in, and I certainly find that a very important thing to remember. I must say I do love all these sailing analogies. I spent many summers in my youth sailing down on the south coast, so I do enjoy them, and I particularly liked also what you said, Bola, around you know, this concept of the coral reef and the really vibrant ecosystem, and us all working together, swimming along together, and making progress in this arena. So some really great images there. So just some final things for people to take away today. Please do look at the website. I'm just going to ask Gweno to pop that on the screen. Do sign up to the newsletter if you haven't already done so. Some important dates coming up are the 20th to the 23rd of April. We're really excited. That will be our first annual gathering of the Health Anchors Learning Network. We would love to see you there. Obviously, that's going to be an online event in these current times. Also, I think important to say that this is just the start of the journey, and we'll be wanting to keep learning from all of you about how the network can best support your work locally. This is very much an evolution. And as in all good networks, we will all get out of it as much as we put in. So please do everyone contribute very actively. That's the only way in which we'll all get benefit over the coming months and years. So I think that's just about it, other than to say thank you so much, everyone, for kindly contributing your time this afternoon. Thank you so much in particular to our speakers and for everyone who's been involved in organising such a great programme today. So we look forward to seeing you at a future event, and also obviously for everyone taking the opportunity to connect with each other. It's not only about the events, it's also really about the work that happens outside them. So please do make the most of the opportunities that the Health Anchors Learning Network will give you, and we look forward to seeing you again soon. From me though, that's it for now. Thank you very much, everyone. Have a good evening.